Hi, I'm Dr. Dylan Goveas. I am an arthroscopic surgeon and I specialize in shoulder and knee arthroscopy. So let me give you just a briefing on what arthroscopy is. Arthroscopy is basically we operate with very small incisions. They're called stab incisions, or in our language they're called portals. So what happens, like when you want to see the shoulder joint or the knee joint, through a small portal we just place in the camera. So once you place in the camera, you're able to go all around the joint into the tight spots. And we have special lenses with particular degrees, with 30 degrees and 70 degrees. So we are able to look all around the knee as we are looking when we do an open procedure. So through subsequent portals or stab incisions, we can perform the surgery. So through one portal we see the joint, either the shoulder or the knee, and to the subsequent portal we perform the surgery. So what are the advantages of arthroscopy? Well, first of all, it's basically the surgery is performed through only stab incisions. So the healing is fast and the pain is less because there's less of soft tissue dissection, and the recovery is faster and the hospital stay is significantly reduced. So typically we discharge patients the next day. Suppose we are operating a patient today, he gets home the next day. And the other advantages of arthroscopy is that you can make a thorough diagnosis because you are looking right inside, and certain procedures where it becomes more easier arthroscopically than open, like for example meniscus repairs, where it's very difficult to do it open, but it's much more easier to do it arthroscopically. Okay, so let me just tell you what procedures we usually do in arthroscopy here in our institute. So when it comes to the shoulder, many patients, I'll just tell you the common complaints. They complain of pain while lifting the arm. Some patients complain of they can't lift the arm at all. Even you need to hold it with the good arm. So these are called rotator cuff tears. So what happens is, like when there's a rotator cuff tear, the joint is jeopardized. So once you go on with the arthroscope, you can make the diagnosis and repair the rotator cuff, and then the joint is just restored. Because if you don't repair the rotator cuff, then over a period of time it leads to arthritis of the shoulder. So that's one common procedure which we do here. The next procedure which we do is that some patients complain of pain again while lifting the arm at a particular angle, and that's shoulder impingement. So you have a bone, what we call as a spur, coming from the bone on top of the shoulder and hits the ball. So when the spur contacts the ball, the patient complains of pain. So we can do a small procedure which we call a subacromial decompression, where we just remove that spur. It takes just about half an hour to 45 minutes, and that is done. Another common procedure is for shoulder dislocations, what we call as an arthroscopic Bankart's repair. So again, the recovery time is significantly less because the surgery is performed to just 3 incisions. So the patient can go home the next day, and there is faster recovery because there's less pain, and the physiotherapy is more easier to perform. So these are just some of the procedures in the shoulder, and of course there are many more which there's no time to elaborate that much. When it comes to the knee, the common procedure we perform here is a meniscus repair. So meniscus is a structure which is of vital importance in the knee for normal loading of the knee. So we repair the meniscus, and also patients come with symptoms of instability, typically after a sports injury or after a rotorographic accident. So you can have instability of the knee in the forward plane or in the backward plane. So if it's a forward plane, then we perform what we call as an ACL reconstruction, or anterior cruciate ligament reconstruction. And if the knee is unstable in the posterior, backwards, then we do what we call as a PCL reconstruction, or a posterior cruciate ligament reconstruction. Apart from that, we also perform a lot of for patients with rheumatoid arthritis who are refractory to treatment. We do something called a synovectomy, where we remove the bad tissue and thereby they get relief. We can even remove loose bodies. So these are some of the procedures. I just elaborate only a few of what we do here in this institute in the shoulder and knee arthroscopy. Thanks for watching.